Health Watch is presented by UMass Memorial Health Care. Here, caring for you.
Welcome to Health Watch, presented by UMass Memorial Health Care. I'm Brittany Schaefer. Today's topic is pediatric cancer survivorship.
Pediatric cancer survivorship is an evolving field of research. We're learning more and more about how to follow children who have successfully completed treatment. That is one of the successes that we've had. When I finished my pediatric residency in '95, an example is neuroblastoma. At that point, in 1995, there were almost no survivors of high-risk metastatic neuroblastoma. Now, a recent survivorship program opened, which is enrolling neuroblastoma patients, and they've enrolled 150 patients in just 3 months. So that's a major success that there are survivors. I think we're learning more and more about how to follow these patients.
Are some forms of cancer more likely to reoccur than others?
There are some types of pediatric cancers where the risk of the disease coming back is higher than others. Some of the brain tumors, some of the solid tumors, we don't have as high a cure rates. One of the really important messages for pediatric cancer patients and their families is that we need to follow these children probably for the rest of their lives in terms of making sure that they're doing well, the disease isn't coming back, and that we're taking care of problems with the long-term side effects.
What can parents do to help a child get back into a regular routine with school, sports, and friends?
One of the things we really strive for is once a child has gone through treatment for pediatric cancer, we want to integrate them back into their regular social milieu. That includes going back to school, reconnecting with their friends, and also just learning to be productive children and adults. In 2018, the issue of survivorship has become much more a focus of research and of pediatric cancer treatment centers. So pediatric survivorship is now a major program at most children's oncology centers across the country. That means there are dedicated physicians, nurse practitioners, and nurses who have clinics to follow pediatric survivors. And these are typically called long-term survivorship programs or late effect programs. After a child has completed chemotherapy or other therapies for cancer, we typically follow them very closely for the first year, and then after that, we follow them at intervals that get longer and longer. So up to a point, eventually children will be followed approximately once a year at a clinic. We are learning more and more, though, about the late effects of chemotherapy, and it's becoming more obvious that we need to follow children and into their adult years.
Is there anything parents and children need to be mindful of as the child rejoins society?
As we integrate pediatric survivors back into their regular social systems, I think it's important to recognize that it's been very stressful undergoing therapy for pediatric cancer. So there's a lot of anxiety and almost post-traumatic stress for these children and their families. And that can arise at any time as they become adolescents and young adults.
How often should children be screened following successful cancer treatments?
Typically, within 2 years after treatment, we transfer children into long-term follow-up programs. And these programs are designed to help children and help the families understand, first of all, what chemotherapy drugs and other treatments the children received, and also to help their physicians be aware of potential side effects for different drugs evolving over time. So the interval gets longer and longer, but it's apparent now that we need to follow children probably for the rest of their lives.
Does surviving childhood cancer have any later effects on a child as they approach adolescence and adulthood?
The success of pediatric cancer is that we are now curing more patients. One of the downsides of our cures is that we are exposing children to pretty toxic chemotherapy drugs, and we're learning more and more now that we have children who are surviving that there are late effects, and almost 75% of survivors will have some major chronic condition that is related to the therapy that we've given them. Some children develop hearing deficits, some children have problems with learning in school. There are other things that arise. One of the challenges of pediatric cancer is that we treat children from infants through adolescence. So the impact of therapy is going to be very different on a 3-year-old versus a 12-year-old or a 17-year-old. And I think we have to be very aware of the stresses that therapy has on different age children. For instance, a teenager may be mostly worried about losing their hair and not being able to go to prom, whereas a 5-year-old is worried that they can't play with their friends, or they're missing out on really important things in school. So it's very different for different age things, and we try to adapt our care as best we can. Pediatric cancer survivorship is it's a good problem to have. Much better to be taking care of children and their problems long term than not having them with us. So I think pediatric survivorship has been addressed at the national level at the Children's Oncology Group and the National Cancer Institute in terms of generating and supporting patient portals. There are multiple different portals now available and on the web that can keep track of patient information and help physicians take care of these children over the long term.